Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hello there, Dr. Kalarina Woodard here again, and today I'm going to be going more in depth about thyroid and thyroid hormones. I've done a video in the past on explaining more about the importance of understanding thyroid hormone, the conversion that happens in order to make that active, and then as well as common symptoms or things that we might see on blood work. It was a longer video, and I wanted to go a little bit more in depth because I think that this is something that's extremely important for patients. I think it's something that we see way too often. So I believe that we all need to understand the thyroid and its role in physiology, its role in how our patients are feeling. So today I'm just going to go a little bit more in depth in that. Now, because I see more and more thyroid panels showing up as irregular, I want to elaborate on the importance of this because it's not just the thyroid's fault. The thyroid isn't dictating everything that's going on with our physiology. It all works together. Our physiology as a whole is impacting each system individually. The thyroid is heavily impacted by stress, and it adapts accordingly to the stress that we put on it. Here's what I mean by that. Your thyroid, it dictates your body temperature, your energy production, right? The active T3, your oxygen consumption, your metabolism, your fertility, your digestion. Your thyroid hormone is so helpful for all these things. However, if you are under chronic stress and all the things that chronic stress entails, your thyroid is not going to prioritize healthy metabolism, healthy hair, skin, nail turnover, healthy body temperature regulation, because your body's trying to prioritize survival, not these luxury items. So the body does not want the high metabolic demand whenever we're undergoing that sleep deprivation or chronic illness or overtraining. Your body turns into preservation mode, and that's where the thyroid comes into play and gets most of the blame. The thyroid, all the luxury things that it likes to help us with, like the skin, hair, nails, metabolism, energy, vitality, it's going to take a back seat to stress. So yes, we do see a lot of people getting medicated for their thyroid so that we can get some of those good things back. But we still have to understand, why is my thyroid adapting in the first place? And your thyroid is going to adapt. It's just what's going to happen. But how does it adapt? With chronic stressors, our HPA axis will begin to downregulate to prioritize survival over thriving. So we're going to cut away a few things, and we're going to decrease our active T3, the high energy vitality hormone, and increase reverse T3. And reverse T3 isn't inherently bad. We don't want to say this is like good versus evil, good guy, bad guy. It's a sign that your thyroid is adapting. And physiological adaptation is important. It's how we've made it this far. We have to adapt. But acute stress, what happens and what's supposed to happen is cortisol rises. You conserve energy, but you got to use that energy. And you get this temporary survival boost. With chronic stress, we go into downregulation, conservation mode. And that's going to lower the active T3 and increase the reverse T3. And this is also going to reduce your reproductive signal. I talk to females about this all the time. If your body's trying to survive, or if it thinks it's in famine or war, it's not going to prioritize healthy pregnancies. And it's also going to cause more fatigue so that you do slow down. What are the chronic stressors that I talk about all too often? Here's the short list. In modern day today, sleep deprivation. We work a lot. We may not sleep well, or we may be up all night on our phones or on the TV. This is going to cause more stress, more adaptation via the thyroid. Chronic dieting, and we'll just say chronic under eating. The yo-yo diets are so bad for your physiology because they do not signal safety, signal that you're consistently getting the nutrients that you need, and they're also going to impact your blood sugar stability, which is so huge. I talked about blood sugar in our last video, and I'm going to go into a little bit more depth about that in the next slide, but blood sugar instability is going to impact your stress, excessive exercise, and this is a scale because there are high-level athletes that can handle more exercise, more activity during the day because they're well trained. So you just have to balance exercise with your body's ability to recover and adapt. That's where having something like wearables lets you know how well your body is adapting. And if it's saying don't train today or you're not adapting today, if you continue to push through that and go through what we call excessive exercise, you're going to impact your thyroid. And you're going to impact your thyroid's ability to convert its hormones. Emotional stress, overthinking, being a parent, relationships, work stress, these are all things that are going to cause low level or even high level chronic stress. Inflammatory foods, poor diet. It just comes down to poor diet because inflammatory foods are going to impact your blood sugar stability. Chronic pain. This can be because of inflammation or just the fact that alone, chronic pain, chronic low back pain, chronic hip pain, chronic tendonitis, because of excessive exercise, can go into stress. Illnesses or infection, environmental toxins, depending on where you live, you can take the dive into what kind of toxins you're being exposed to, and that can give us a cue that it's impacting your stress physiology, which is going to impact how your thyroid responds. Stimulants or other supplements that are trying to replace recovery, it's like saying the same thing over and over again. You can't replace quality sleep and balancing your nervous system. And me working with athletes, very often I see supplements and stimulants becoming a replacement for true rest and recovery. These things are not going to help your body. We're smart. Our physiology is smart. You can't biohack everything. You can't 100% biohack sleep and pure recovery. So these are the chronic stressors that in today's society we see people going through, or we see people experiencing more and more often. So I mentioned blood sugar and how are blood sugar and the thyroid connected. Cortisol is a big piece of this. So one of the big mistakes in functional medicine or even conventional medicine is just isolating one system. Like I mentioned, we're blaming the thyroid for this. We have to take into account that something like blood sugar and cortisol can heavily influence the thyroid. When blood sugar becomes unstable, whether it's from too many refined carbohydrates or poor eating, too few calories, chronic stress can actually, it has nothing to do with food. It can impact cortisol, which is going to impact your blood sugar stability. Poor sleep, waking up, drinking caffeine, a high amount of caffeine first thing in the morning, or excessive fasting, the body's gonna compensate. So we have to take that into account. One of the major compensating hormones is cortisol. Typically, cortisol is very helpful. It's our survival hormone. I've talked about this in the past. You need to have cortisol responding like it's supposed to. The problem becomes when it's chronic. So cortisol mobilizes glucose for that quick survival stress energy. We need to go, we need to get out of here, or we need to go hunt the thing. Cortisol does its job. Whenever it's chronically elevated, cortisol will start impacting blood sugar even more. And over time, the body begins to shift its resources more towards survival versus blood sugar is going to come out, glucose is going to come out, insulin's going to do its job and grab that, bring it into the cell so that now the cell can respond. If we're constantly having this happen, insulin, this is where we start to become insulin resistant, which I talked about before. Insulin can't do its job as efficiently, and we start seeing glucose slowly go up. And then over time, hemoglobin A1C slowly going up. Now, how does the thyroid have anything to do with this? Because the thyroid's sitting here looking on saying, we have some kind of survival discrepancy issue going on. I'm not going to prioritize my job of converting converting my hormone into active, healthy T3. So that's where the thyroid starts to run into issues when it comes to conversion if something like cortisol is off, which is also impacting our blood sugar. I also wanted to talk about the healthy lifestyle trap because I would say years and years and years ago, early on into chiropractic school for me, I got caught into the healthy lifestyle trap where you accidentally underfuel your physiology because you're doing everything that the influencers say. You're, a menstruating female and you don't realize the detrimental effects of fasting. So you think in an 18-hour fast every morning, eat by about 1 o'clock, only drink coffee in the morning, is healthy for your physiology when it's not. That's something that I will, personal note here, that's how I heavily impacted my thyroid because I thought, as a female in my 20s, that I needed to fast as well and only drink coffee until 1 o'clock and then also continue to train just as much as I was, putting my body into the survival state, not fueling adequately. Also, being extremely constricting on carbs. So I know we could get into the carnivore, no carb diets, but if I was eating some carbs, I'm not putting myself in ketosis, but I'm just such low carb and I'm training like I was, that's going to impact my thyroid hormone conversion. I was not recovering like I was supposed to. And because my eating window is so small, and if we talk about how well your body can digest amino acids for my size, the eating window that I had was so small that I was going to be getting insufficient protein. Your body can only break down and utilize so much protein for muscle protein synthesis with each meal for each time constraint. Those amino acids weren't waste. Let's say every time I ate 100 grams of protein or even 50 grams of protein. The excess of probably 15 to 20 grams of protein, amino acids for me, depending on utilization of those amino acids and the quality, they could still go towards other stuff, but it's not going 100% towards repair because your body can only break down so much. So that's a problem too that I'll see people run into is they have such a short time frame for eating. They're not fueling enough. Athletes are not fueling enough for their workouts. And they're thinking, well, I'm getting enough protein and I'm drinking 5 protein shakes a day when I eat my beef or my chicken. It's like, no, that's not that's not doing the job for you. I should do it. We'll do another video next on how to break down and digest your nutrients properly. But also poor sleep. And like I mentioned, stimulants, replacing something that's actually helpful, which is true recovery. We cannot forget to hit on iron and ferritin, which is something that I did leave off in part 1 of this. But iron is essential for thyroid hormone conversion. And so if it is low, if your diet is lacking iron or you're lacking the ability to absorb iron, that can definitely contribute to thyroid hormone issues. So say we look at all these other blood markers and blood sugar is pretty stable, all these other things are stable, but we're having huge thyroid symptoms popping up. We need to take a look at iron because iron is important for so many different things. And I did not know this until later on in my career on the importance of being able to properly absorb iron and store it. I know that excessive amount of calcium, and some people will, this is why I'm not a big prenatal fan, they'll take their calcium with their iron supplements, and that can impact how well you're going to absorb and store that iron. But then on the opposite end of the spectrum, if you take iron with something like vitamin C, you're going to absorb it so much better. Your gut health dictates this a lot. So alone, what I'm trying to say is nutrients and something as important as iron, which I left out talking about before, could be not absorbed properly, which can impact a lot of females. I'm going to say females more than males is where I would see this impact their ability to convert their thyroid hormone. Also, the nervous system. The nervous system on top of iron, of course, we can't not talk about the nervous system and how it controls so much more than people realize. So, of course, the chronic stressors that I mentioned for modern day are going to impact your nervous system, send you into sympathetic overdrive. And by doing so, that can impair so many other systems. It's going to impair your digestion, which is going to impair your ability to absorb nutrients to give your body what it needs. It's also going to elevate cortisol, giving your body too much blood sugar or blood sugar dysregulation, altering other hormone signals, and reduce recovery. So paying attention to your nervous system and that balance that's so important between the sympathetic and the parasympathetic nervous system is going to be another thing that helps our patients heal their thyroid and better their thyroid hormone conversion. So one more time, what are the most common symptoms and how can we relate that? So we're going to see our patients come in and they're going to mention that their TSH came back off, but we're going to ask more questions and we're going to know that we need more detail about that. So what symptoms matter the most? Fatigue, brain fog, constipation, hair loss, and nails. Hair, skin, and nails is a big one for thyroid. And then the cold tolerance, that's where we start to see even more. Maybe there could be some autoimmunity going on as well. Poor exercise recovery, infertility, anxiety, and depression. This is like a lot of our patients that we need to be asking, what does our thyroid look like? But whenever we see these symptoms, I don't want to say, we're not going to be those people that say thyroid only, because we know it's a full system approach. We know there's nutrients involved. We know the nervous system is involved. But these symptoms right here can help us identify for our patient, you're not getting the energy, the luxury symptoms of having a healthy thyroid because stressors are impacting your thyroid hormone and your thyroid hormone conversion. I like this little physiology is interconnected graphic here because I want you to be able to visualize how stress impacts all of our systems. So stress adaptation impacting the nervous system, impacting nutrient status, impacting cortisol, impacting blood sugar. Also, of course, that's going to impact your thyroid, impact your inflammation, your pain, your ability to recover from pain, your circadian rhythm, your melatonin, your cortisol, they go together too. Your cellular energy, ability to utilize nutrients and then detox from toxins, and then your reproductive hormones for even more health and vitality. It's all interconnected. And while, yes, this is titled Thyroid Part 2, it should just be titled Stress Adaptation Strikes Again, because your stress and our patient's overall global system picture is impacting our thyroid. So what should we focus on to help our thyroid heal? Thyroid specifically, this is just to help our whole body heal. We have to have adequate calories. We have to signal safety. We have to have adequate protein, amino acids throughout the day. Carbohydrates appropriate for your activity level. And I find that most often, the thyroid has to have carbs, by the way. It needs some carbohydrates in, we'll just say the majority. Vast majority of people need carbohydrates. Not that way, I'm not leaving out those people that do well, really well on carnivore, but the vast majority of people do need carbohydrates. And sleep, resistance training, building muscle, and signaling that's going to help stabilize your blood sugar as well. That's something that our patient should focus on, as well as sleep and recovery, enough nutrients and hydration, and having a proper circadian rhythm schedule. Circadian rhythm isn't just sleep. Circadian rhythm is eating. Circadian rhythm is your daily rhythm of stressors, of work, of exercise. Having a healthy circadian rhythm is so important for your overall thyroid. Last thing here, symptoms are not a sign that your body is failing. It's a sign that your body is adapting. I liked this quote, and that's why I wanted to put it on the last slide here, because symptoms, they change a lot, and they can be different from one person to another. But if we look at it not as like, now I need to medicate this symptom, and we look at it more from the aspect of, how is my body adapting and why is it causing this symptom and what is my body adapting to, then we can do a better job One, being preventative for next time and educating ourselves so that symptoms don't just continue to compile on top of us, but it can help us when it comes to treatment. It can help us when it comes to understanding what we have going on so that we can better manage our stress. This was helpful when it comes to understanding your physiology, specifically more towards thyroid focus, but also how our whole system works together. There could be more and more and more slides that we talk about this. I don't want to say like beating a dead horse when it comes to understanding stress physiology, but understanding stress physiology and its impact on the thyroid and the fact that the thyroid does not act alone is extremely important. And I think it's something that we should educate all of our patients about. I hope you have a good rest of your day. Thanks for tagging along.